The views and opinions expressed on the following program are not necessarily those of the staff and management of Salem Media of Hawaii.
Aloha, this is Bianca, and thank you so much for joining me today. This is Be Fit for Health, a show basically designed to get you into the best possible shape, health, and well-being. We are here to educate you as much as possible on options that are out there when it comes to what you can do to get the best nutrition, to ask the right questions to your doctors that you're seeing. Also, what other options out there to help you feel better. My sole purpose in creating this show is to help others like myself. I've also have some conditions that I'm working through and have been for the past 20 years, even though I am a fitness trainer and coach. I'm a human being first. And like everybody, I have my deficiencies and off balance situations that are occurring in my body as we speak. And as we get older, things show up much more predominantly in areas that we may have abused as youngsters. And, for me, I have fibromyalgia. And I think fibromyalgia occurred because of the type of heavy weightlifting I may have done in my youth. I was squatting almost 300 pounds, bench pressing almost 200 pounds. Yes, and I was only 130 pounds at the time. So you can imagine the stress that I was putting on my joints and my entire system, my nervous system. And, it didn't help me. But now that I'm more educated, obviously I train smarter, not harder. And I'm doing the best I can to balance out my body to a place of well-being. So with that being said, today's show is going to be pretty exciting. I'm going to be bringing on Kelly Nash Montone from Elctro Equiscope equipment that we were talking about in past shows. I wanted to bring her on again because I wanted to talk about some case studies and things that she's done that actually improved a certain quality of life for individuals who may have been suffering from pain or who may have been gone through some kind of rehab, but it hadn't quite fixed the problem, and they were still having these residual effects. So she goes in and maybe plugs in the holes where they may have been open or left open, so to speak, from traditional rehabbing. So, for me as well, having a neurological dysfunction, I am, looking at all different avenues when it comes to our well-being. So one of the things too, and you know how I usually geek out, and I know I don't have much time today to go through it, but I wanted to kind of give you an idea that there are supplements and foods that we need to consume to help support the nervous system, right? And you may not be aware of it, but we all know about B12, and we all know that B12 provides energy, but why does it provide energy, and what exactly does it do? And I have some idea here based off of what I know as a trainer and as a nutrition coach. But B12, basically, if you're deficient, there are some things that you would experience, and some of the symptoms could be peripheral neuropathy. And if you don't know what neuropathy is, it's like this weird tingling in your skin or your muscles. You may feel like there's like vibration going on in there, and you're not controlling that. It's just happening on its own. It's really uncomfortable. It feels like permanent goosebumps. And, and there's a lot of miscommunication happening. So if you're deficient in B12 specifically, and a lot of vegetarians usually are because you get B12 from proteins. And so if you're not eating red meat or regular protein like chicken and fish and things like that, you're not receiving B12 on a regular basis. You have to supplement it so that you're not experiencing some of the symptoms that are there, like memory loss. You might also have like dementia, things like that occur because it's not supporting the nerves. So you need to pay attention to some of the symptoms that you may have. Could it be that I'm not taking enough B vitamins? Maybe you need to get a complex B vitamin, a good one that's out there, like Integrative Health, or maybe there's another one that was, I want to say Harmonious Body. There's so many out there that are fantastic, and I can put it on my website for you guys to look into. But some of the other B12s that might be popular that you guys know about is B5, which is pantothenic acid. If you're deficient, you can develop acne, psoriasis, other types of skin disorders. It actually does help with your skin. There's also niacin. If you're deficient, there's other symptoms that you could be getting, weaknesses of muscular areas, mental confusion, diarrhea, dementia, and sometimes even death if you don't have enough niacin. By the way, niacin is another component to the Krebs cycle, which helps the completion of your cells producing a product called ATP, which is energy. And niacin is the most important part of that in completion. So if you don't have that niacin factor, which is called NAD, at the tail end of the Krebs cycle, which is what can cause either oxidative stress or can cause ATP. And you don't want oxidative stress because oxidative stress ages the body. ATP gives the body energy. So niacin is an important supplement to take as well, and that's a B3 vitamin. And if you were to look at, you can look at B2. If you're looking at B2, it actually helps with transporting certain types of acid chain cycles, which helps with catabolizing fatty acids. B1 also helps with releasing energy from carbohydrates. It also helps with your RNA and your DNA production. It helps with nerve function. So obviously getting a complex B vitamin type of supplement into your diet regimen to help combat some nerve issues, whether it's in your brain, whether it's in your spinal column, whether it's in your colon or your bowels or what have you. These types of vitamins help support your nervous system. Some of the foods you can eat before I get into Kelly's bio, just to remind you guys of who she was and in our past shows and what she's been doing lately. The best foods that you could eat to get vitamin B is whole grains like brown rice, barley, meat, red meat, poultry, fish, which I had mentioned, eggs, some dairy products, some beans, legumes, seeds and nuts like sunflower seed, almonds, dark leafy vegetables like broccoli, spinach, fruits like citrus fruits, avocado, and bananas. So these are really enriched with vitamin Bs. So if you guys are curious about what vitamin Bs do and the different types of vitamin Bs, there's a lot of them. You can look them up. There is PubMed.gov. You can go into what each vitamin B does and what is it associated with in the body. And then you can look up on YouTube. There's a couple of great doctors that talk about what foods are great with, enriching your body with certain types of vitamin Bs, and then also what can happen to your body if you're deficient. But I do implore you, please empower yourselves, get this information, especially if you're having neurological disorders and you don't know what to do with it, and how to combat it. Your doctors may not say take supplementation, but, if you're not eating well and you don't have a well-balanced diet, this may be something you need to look into. Okay, so we're going to take a really short break, and then when we come back, we're going to have Kelly on the line, and we're going to talk about your nervous system still.
The Honolulu Club is still here for you. We are providing the safest workout conditions on the island, with modified safe distancing, indoor and outdoor classes, large open work floor with clean, sanitized machines and free weights. Let the Honolulu Club be your one and only fitness destination. Go to honoluluclub.com and fill out the trial pass today.
Have you heard of microcurrent therapy? If you suffer from chronic pain, arthritis, sports injuries, ligament injuries, or migraines, the Elctro Equiscope can help. This non-invasive treatment system is drug-free and shows no negative side effects. If you are seeking pain relief and want to boost your immune system, schedule a demonstration or consultation by calling Kelly, your microcurrent electrotoxologist, at 485-9697 or follow on Instagram at Kelly's Time. Make your appointment today.
Okay, we're back. So I've had Kelly on the show, I believe 2 times before, and she was on the last time with John Thorpe, who is one of the pioneers, if not the pioneer, for the Elctro Equiscope. And he has brought it to many medical clinics and doctors' attention to what it does and how it can perform in your body and how it can correct things that are off balance and correct it to a place where it becomes balanced. And Kelly has been trained under John Thorpe Institute, and she has been using this device since the 90s. I mean, she was using it on herself first, but then she saw such a huge difference in the way that her body changed and also got into a place of homeostasis where she was much more centered and balanced. she was a pro soccer athlete, and so she understands the body well. She knows what you can put your body through and how your body can break down and not recover as quickly. But she found this device, and she felt that this device was so incredible. She got trained as a practitioner, and she is now working here in Hawaii and has been for many, many years. And we're really lucky to have you here on the island, not only to service us and get our bodies back into alignment, but also to educate us. And, you know, we really want to dive into some of the cases that she has gone into with some of the patients she's had, when challenging ones that she was able to overcome with this particular device, and all the good technology that it comes with it. So we will be educated through Kelly Nash Montone, and I believe she's online. Kelly, you there?
I am here.
Oh, wonderful.
Thank you for that.
Oh, yeah. I'm so excited to have you back, because every time we get you on here, we run out of time when it's just getting good. And this time I wanted us to talk about specifics, because, you know, you treat me, and, you know, with my ailments that I have a spinal degenerative disc disease. So you're always trying to regulate me, and I'm very chronic, as you know, but the audience does. I'm very chronic. I have scoliosis. I have a dehydrated disc with it, part of it's torn, and I've got, you know, arthritis and all these good stuff that's happening all at the same time. And I'm coming to you to be my miracle worker, and you do a fantastic job with me. I always walk out of there feeling like this is what my body should feel like. But unfortunately for me, because of 20 years of living in this type of state, you know, you're doing your best job to educate my system to get back into alignment. And I know what you do for me, but I wanted to talk to you about what you've done with other patients. But before we get to that, can you tell the audience that hasn't heard yet about the Elctro Equiscope, what exactly is this machine?
It has an excellent source of energy to benefit chronic and acute injuries, as well as any disharmony, or as we all know that word as a dis-ease. Our body's not at ease. And it's here, it's developed to go in and recharge and break through anywhere that there's not an energy flow, so that our body can operate in this harmonious way that it's meant to do. And so it's recharging each cell and every tissue, and it's deep to the bone. It can correct and make sure that our cells are holding the appropriate charge to live healthy and continue to make healthy cells in each of those tissues, whether it is nerves or muscle or bone or fascia or ligaments or tendons, anything in the body that it needs to break through and get this energy flow, because we need blood to flow and circulate. We all know that. When that stops,
Right.
we stop.
Right. And I know that
And I hope that helps your listeners. Yeah.
This is a current, like, frequency-based equipment. So basically you're working with frequencies like, from what you've told me. So, and people don't understand frequencies. So delta, what does that mean? Delta, what does all this, the frequency mean?
Delta is our most sedative state, where we're in a deep, deep sleep, that where our body is in a complete rest and restore mode. And it is a very broad frequency that harmoniously will create that state for you. And then transitioning into a theta state would be more like your REM. You're in a dream-like state, still very relaxed. Right. We use alpha, which is like the grounding of our earth sphere, anywhere between 7 to 14 hertz. And we get into betas. If the body allows us to get there, we'll go there. Sometimes to shut off that autonomic nervous system, we need to stay in those low frequencies to just let the parasympathetic take over and relax and restore, because that's where our bodies will heal.
Yeah, so with me, I guess I know, and I complain a lot. I think I'm in that fight or flight program too often, and you've always been trying to keep me in that state of balance where I'm calm and relaxed. Because every time I come see you, she keeps me in Delta for as long as she can, because that usually puts me in a state of comfort and I start to
It is
relax.
so
It's
funny,
amazing.
the energy that you walk in with, and then once you're on the table and we start, and your whole body just
Melts.
really goes into the restore. Your speech slows down, and everything is mellow, and you really do resonate. And I can tell, you can tell when I start going higher. Oh, I'm starting to get achy. Okay, your body has been, like you were saying, for so much time, and these other frequencies, that it's time now to help your body re-educate those patterns.
Yeah. Yeah. And it takes time, unfortunately. Well, like anything, right? If you're going to work out, you're not going to be in shape the next day. It's going to take you months before you get some kind of clue that, what you're doing is working. And even with nutrition. Yeah.
Correct. And we're so unique and individual, and we all treat our bodies differently. We have different mindsets. It all plays. It's all connected. And in so many ways that, for somebody that treats their body really well and hydrates and has a good outlook and, does right things with the right action, their body may respond faster, eating
Right.
the right foods and listening and tuning in, or maybe they're in a space where they're listening to their body that doesn't want food and just water or, other supplements. So it depends on everybody. And too, I have seen chronic cases that with the protocol of 3 consecutive sessions are great. They're better than they have ever been before they even felt any dis-ease. So it totally depends. I've seen other chronic ones where, that same knee injury that I got better, I can't say I got better. I turn on and I run plates or probes with some electroconductive gel, and the instrument does all that harmonizing. I just control the panel and send those frequencies and watch the biofeedback and listen with the body communicate. And I've seen some of those chronic ones take a little bit longer with, like you're saying, a couple months, and with discipline of coming in, taking care of you, and I'll help you with that. And that's what when you look for somebody as a practitioner on your health team, I hope that's what you get back, the time that you get to put in, and somebody on your team helping, supporting each of those transitions.
Well, what I also like about this machine is that when John was on the show last time, I asked him about the NASA missile technology, and then I asked you about it, and you guys are really good at educating your clients. The delta frequency, if I remember this correctly, please correct me if I'm wrong, is that it's a wider scope frequency where it catches a bigger area of the area of the body. And then the higher in frequency or so, or different frequencies you get more specific into the spot in which there might be a disconnect, correct?
Right. Makes it smaller, like needle to needle point, instead of the delta, more like a quarter. It is wider. So we help the body through that transition. And there really is, if you're not breaking through at this delta, there's no point to try to push a needle through at something that a quarter is not getting through. So we just keep the body where it needs to be to re-educate, and, one day, someday. And either way, our expected results are increased flexibility, more range of motion, and less pain. And with that being said, you have an hour, and most everybody, it's somewhere in there. It's less pain. Okay, we're winning. That feels good to have less pain. That feels good to have a little bit more range of motion. I can trust my body again. I can trust moving my head side to side, or, looking in my rearview mirror if we're working some neck stuff. And day by day it gets better and better, and we're putting the body in a state to heal itself by itself and continuing to do that.
You're so right about the trust thing, though, because there is a certain level of pain that people that suffer from chronic pain, it's one of those things where you start to get fearful of doing things because you're afraid that you're going to get back into that state of continuous pain, especially if you had some kind of relief for a short minute. You just don't want to go back there. And I think when you are able to bring that trust back into play, where your body starts going, oh, yeah, I remember feeling good more often than feeling bad, it becomes more consistent and you tend to be more active. And then your body starts getting healthier because you're more active. And it's a huge accomplishment. And I know that this device is incredibly gifted in the way that it reads the body, because there's nothing out there like it when it comes to this device. Yeah, I mean, it's not a TENS machine. It's not like it's going to go in there and start electrically stimulating the muscle to contract. It's not like that at all. It's more specific to areas to communicate more specifically.
You're right. It is precise. It is focused. We know whether those tissues are resonating. It's not a hit or miss, just stimulate. This is a looped, continuous feedback that's stimulating, capturing the response of that stimulation, measuring it, and knowing that it needs a corrective signal right here, right there, at 100 times per second.
That's crazy.
And we are able to get that feedback within seconds. And how long, that we can pursue to do that, the better. Just to recalibrate, re-educate those cells, because in the end, our healthy cells reproduce healthy cells, and if they're damaged, they're going to continue to reproduce damaged cells. So you choose if what you're going to do for those bodies in there. And one of the best things that I hear is, I know you worked on my shoulder, and it feels really good, but I'm just feeling good all over.
Yeah, because you relax the system.
It relaxes the whole system, and we're opening energy channels that weren't open before.
Right.
And that feels so good. And you treat your toes, you treat your nose. We're one big electrical being.
Yeah.
And it's like flipping a switch to the light bulb, and if it's fuzzing out a little bit, there's something in the wires that need a recharge, or if it's on a battery, we need to recharge the battery. Your phone gives you that signal, low on battery. I'm going to plug it back in and recharge it, and we need to do that for our bodies. And this day and age, we're not getting those sleeps we need. We're not getting that we just push and push and push until there's so much pain referral. We're like, I don't even know where it comes from anymore.
Yeah.
People are like, well, it was this shoulder, but now this whole side of my neck hurts. And are we going to compensate, or let's just take care of those issues as soon as it happens and recorrect it, and let's live a good life.
Well,
so that's what I'm here to promote and share. And there is nothing like it of this instrument's abilities, and it's a really beautiful thing to have in any clinical atmosphere or physician's office.
Well, think about it. Energy medicine is something that people still don't understand, and they don't understand how it works. And like you said, we are energy beings all day long, 24/7. Before we're chemical, means that yes, we have chemical compositions in our system, but we are energy driven, and everything is connected. Whether it's in your cells, or whether it's in your outside your cells, your brain, your organs, everything is communicating simultaneously in nanoseconds. And it's just that when something goes awry, we're chasing symptoms, but this machine basically tells you exactly this area is not communicating at all. We need to restart it so that the other areas of the body isn't compensating for it. Therefore, everything is flowing. It's like having traffic, and then you kind of open up a lane, and then all of a sudden you're flowing through and you're not being stalled. You're going to your destination the way you should be. When you have these traffic situations in your system, like there are highways, you can't go anywhere. You're stuck. And that doesn't help your body to become balanced and well-being. I know that there is a couple of things that your device actually helps treat, and then more. I mean, it talks about inflammation, reducing it, increasing flexibility, but then you guys go into traumatic brain injuries, arthritis, joint ligament injuries, strains, sciatica, headaches, migraines, neuropathy, and enema. You guys are treating very multiple different types of ailments that increase pain.
Yeah. And some of those, cause emotional side effects.
Yes.
There's ways of calming those nerves. And what is emotion is just energy and motion, and refiring those to calm the being and work through different traumatic experiences. And I have had a client who was in a really bad car accident, had a brain injury, and he never felt completely better, but started playing his sports again. He whacked his head again, and just all of these triggers, he's never felt right. And we were able to work through that 6 sessions. I think we did 3 one week and 3 in the next week. And he was feeling immediate results after each one and wanted to continue, was excited to come back. I know there were some detoxification atypical responses of some nausea, but he said, you know what, it actually feels good that I can feel these things. It's different than any of the other, and I know I'm getting better. I worked with him that those were going to be a possibility with his, the severeness of some of his symptoms that he was explaining, but he really made a great turnaround and was able to use his body and his brain and clear that head space and connect some of those neurons that have been shifted around and nerves that have been a little shut down, and work on a lot of those points for him. And he says that he owes his life to the instrument.
Wow, that's
and
huge.
what we worked through
So
in 6 sessions.
So this machine, the Equiscope, how are you able to stimulate the brain? I mean, how are you able to get into that level of depth? Because I mean, do you put it on his head, or how are you treating that?
We do actually. There are acupuncture points on the head that we do use a lot of meridians and acupuncture points, acupressure points, trigger points. There was actually a lot of points that were related to the stomach in that case, and we were working direct through the head. It's a very it doesn't look like Frankenstein. I have a feeling right now that everyone's picturing Frankenstein.
You're electrocuting him.
We can use neck points, with part of those whiplashes to reconnect, and some brain. I mean, we have our reflexology. We have brains in our fingertips. We have brain points in our feet and our toes and our mouth, connected to each tooth and our ears. And so there was a lot of points that I could disperse throughout his body to get everything firing up, and just in a place, in a state that his body felt well to heal itself by itself. We just stimulated that response for him.
So Chinese points is what's also a part of the treatment system.
Very energetic.
Got it.
Yes.
Got it. Well, that's really interesting.
They're highly energetic points to access the body, and all of my experience, it never fails when we can't get through to stimulate some of those points and deeper responses.
So let's
It's
go.
amazing.
So let's go through then some case studies that you were talking about earlier that I'm interested in. So tell me something about people who may have had either a neck injury or shoulder injury, or where they may have done physical therapy, but it didn't really quite pan out. What have you done for them?
I have a case that just came to mind. A client who had surgery. She was in a bad accident, and she had open wounds. And the doctor gave her, hey, we can do. It was a tibia. She broke her tibia, fractured some things in her leg, and hip pain. And there was open wounds on her leg as well. We started working with her, and she said, well, doctor, what's my chances? I'm 88 years old.
Wow.
How much probability do I have after this? You want to do a surgery, maybe put a rod in there. What's that going to do for me? Tell me honestly. She likes her facts. And he said, well, honestly, it's 50-50 with your age, with, the severity and things. And she said, well, I'll take the 50% and I'll just, I'm going to stay home. And it was her son who had heard of the instrument in California doing wonderful things. He reached out to John Thorpe. They said, we have somebody. She's on Oahu. Great. My mom is on Oahu, and let's go. So he scheduled that, and we started working with her and her doctors, and we were watching it topically. The wounds start healing really fast. She was getting more, with the inflammation going away right away, and she just wanted to be able to play pickleball again and get back out there and play with her friends and have a life that she always knew, and also helping her with that mind state, because you get in an accident like this and you think life is over. If, I have 50-50, but 50, what is that? And so we worked about 100 sessions. It was about 4 months spreading out sessions and working with her, and she was finally able to ditch the walker. She was actually bedridden for a while, and a really good turnaround. And who knows, we don't know what the body would have done. Would it shut down? Would other things start to happen? And that was just kind of miraculous. No, the human body is miraculous when given the right tools, and happened to come across the Equiscope. And that's why I'm here on your radio show. I want people to know that it is an option. It is here. I don't know how far your radio reaches, but I'm here, and I know there's an instrument on Big Island, but I can island hop. I know there's different technicians over the nation. And coming with that tibia, actually, I had a young man at the same time who was in a football accident, and he got the rod. He had the plates and the screws, and we worked on him, helped him with his full body rash. He broke out from a reaction to, I think, the pain meds. Then there was a hematoma from the clamps that were opening his leg to get the rod in. That hematoma was the size of a tennis ball, and we both watched it dissipate into the same level as his skin. We started getting him to get weight bearing within 3 sessions, and working with his doctor, knowing his limits, where he could go. Really cool. I want to answer all of your questions. What other instant deep cases that I can think of neck and creating range of motion I had? And what it does, I have a lot of car accidents, I feel, that come, and
whiplash, things like that.
It's sad. There's a lot of whiplash. There's a lot of, if you get even sideswiped and it shivels you anyway.
Oh, it shifts your body completely. I mean, whether it's neurological or structural, it does. It shifts your system completely.
And then maybe you store that trauma in there too.
Yeah.
Extra.
And it comes out in weird moments. You don't even know why you're emotional about something. And it could just be from that trauma of that car accident.
Yes. So the necks are amazing. They're complicated sources, but I do my best to also give my clients, if they're not working with a physical therapist, and making sure if they are working one side with their physical therapist, it's actually surprising they're not doing the other side. So let's, not create more compensation, and make sure you're getting the same exercises in, and creating that harmony and balance and strength and flexibility all over the place.
So you're saying it's never too late to have somebody come in and see you when it comes to, let's say, an injury, like if someone had surgery, even if it's been a year, and they come to you after, you can still find a way to get them to a place where they're not in pain, or they get range of motion back.
To some more comfort, highly. And the same as it's never too late, it's never too soon. As soon as you know your body is not feeling well, or hey, you just you're feeling not so strong, come on in and see where that takes you. Or you're feeling a little weak, or your immune system is feeling a little down. You just need that little extra re-energize. Come take a meditation session with me, a detoxification, a systemic or lymphatic drainage. There's so much that we store in our bodies. And if we can tune in to ourselves a little bit more, there are amazing tools out there to help stimulate and re-energize. And this, by far, blows everything out of the water on any day or time. So it is never too late. It's never too soon, and now is all we have.
Well, what about something on the vanity level? Because, I know they do facial acupuncture to help tighten the skin and collagen, but because yours is so specific in frequency and energy, because they have all these little gadgets out there where you put it on your face and it's supposed to create contraction and supposed to create more collagen production. Can this equipment help with, let's say, rejuvenating the collagen in your face and your neck?
Definitely. And there are protocols for that. We are all trained in it. And it would be great for institutions like spas to have this as an alternative. I know Botox is huge in aging women, most likely. I'm sure there's men out there too that want their face nice, smooth, tight. Yes, this tightens and firms your skin, reboosts it, re-energizes, bringing the elasticity back. So that it works wonders. There's amazing effects and following some of the facial protocols that really help to have the alternative to putting things into your face, which everyone's to their own and do what you need.
Is it discomforting? Like, does it like, I know with some of those tools that are out there, it can be uncomfortable.
I tried it. I hear that too, and I haven't fiddled with too many of those instruments, but this one, you can feel it. We can also turn it down, and it's hard to explain because some people want to feel it, but it's actually when you don't feel it is when most of the work is really happening, because you can totally relax. And Bianca, what's amazing is how many reflexology points are in our face. So you can actually be working your stomach, and you can be working other areas. So it relaxes not only and tightens and smooths your skin and brings all this life back to your face, your neck, a lot of women like their chest area done as well to firm up that area.
Right.
But you're stimulating so much other. So when people get done with those treatments, are like, wow.
Why do I feel good all over? Yeah.
Where did I go? So it is all over. Once again, you treat your toes, you treat your nose, you treat your face, you treat it all. So it's amazing in that sense. And so you don't have to feel it. We can have it so subtle. And most of the time I say, oh, you feel it? Okay, then I'm going to back you down one.
Sorry, I missed that part. Your phone just got muffled. But I was going to say one more thing about that too, because it's according to for you, it's a lot more inexpensive. I mean, people are spending thousands of dollars to go get Botox and injectables and other treatments that, like surgery even, to like in the thousands, like tens of thousands, to get a younger looking face. But through a process of a natural energy communication and, letting the body do what it's supposed to do naturally, you're allowing the body to get younger via this type of treatment, and saving a lot of money, I would think, at the end of the day too, because I can't afford this. I mean, I can't afford to go out there and try to make myself look fantastic. But, plus at the same time, when you go get surgery and other treatments, you're not treating the body like you're saying. There are a lot of points in the face. There are a lot of muscles, small muscles in the face that people don't realize. You're treating not just the face, but you're treating the body without even trying to, which is such an added plus. I mean, that to me is worth it.
And there's just when you feel good, there's this confidence too that you start carrying everything, your body in a different sense, and you go out in the world in a different way when everything's, so to say, clicking or feeling good and one with all. I think one of my other cases, kind of on the face area, I had a post-operation polyps removal client who the doctor said, you may never smell again. He's like, well, this is why I came to you, I mean, I don't have pain, but I want to be able to smell. I know those plume areas. I know what they're supposed to smell like. I can't smell them. So, well, your nerves have been shut down for so long that I don't I don't know if they'll wake up. It may take a while, and they may never. So gave him that. After 1 month, he said, okay, I've tried everything the doctor gave me, and I've tried, the nasal cleanses and what the doctors recommended. And he found me through another chiropractor and said, you may want to try this. I know you're aligned, and you may want to try this therapy that works nerves, that works muscles, tissues. One session, it was not even 30 minutes, and he could smell one of the gels I was using.
Wow, that's crazy.
Smelled the vinegar that I cleaned the probe with
Yeah.
right next to him.
Oh, wow.
And he followed protocol. I seen him once in 3 years. He said, the flowers are starting to smell faint again. And so we stimulated the nerves, and he hasn't called me in over a year. So there's some beauty to bringing things back to life. And that's what it is. This instrument can work on all living creatures, anything that, four-legged, two-legged, has wings, has
Yeah, you treat
tail.
animals too. You treat pets
So we
as
work
well.
on the yeah. This Equiscope can help harmonize and work on animals that you don't know what is wrong, and they're so amazing and beautiful creatures to work with because there is no placebo effect in them. They don't have a mind either to say, I think it's working. I don't know if it's working. They're just there. They hang their heads. Their eyes get, relaxed, and they can also let us know, hey, that's a little too much. So give a little shake, or the horses will stomp their feet, or a dog's ears will, flitch a little.
They flick their ears constantly, right?
Yeah. Before we start cutting and pasting everything, trying to dissect what's going on, maybe before we start those traumas, there's something to do, or after that, a surgery that they needed to have, we can help them heal a little faster, a little better, a little stronger, and
what makes me
friends.
feel so important about the pet thing too is that pets get ill and then their owners can't afford surgery, and it's because it costs thousands of dollars, and pet insurance doesn't cover much. So instead of putting them down, your baby, you take your pet to Kelly or something. Ask, or at least have your vet contact Kelly. So that she can introduce this machine to their office, so that instead of putting your pet down, they can try to treat your pet in their office, which will be another service that that your vet can offer to their clients. Not only is it good business, but it's also a way of treating animals that may, in fact, put them in a place of balance, and they don't have to be put down, or they don't have to take these medications that are just not good for their body system. I mean, I'm not saying not to do anything that's against the veterinarian, but I'm saying there's options that can maybe sustain the life of an animal for another couple more years. And you get to live with them for a couple more years. I mean, I can't imagine putting down my pet. I love my animals so much. It's a part of my life. I mean, I would do anything possible I can to keep this animal healthy and living a long life. But, if my only option is to put him down, what do you have to lose, right? And to get this treatment for your animal. Because if it doesn't work, then at least you've done everything you possibly can. And this is why the show is here, guys, is to give you options. And Kelly, your option is really a special, people don't realize this, and they will. What you're doing here on this island for your clients is a big deal. What doctors don't know, and I'm not just talking medical doctors, I'm talking like veterinarians, I'm talking like dentists, I'm talking like, different scopes of medicine. Everyone can use this machine to help treat not only pain, but also, balances, off balances of the body system.
That's right.
Yep.
That's right.
So we need to get these machines in the offices of doctors, is what I'm trying to say.
I agree. I highly agree. It's my goal. Right now, I'm booking a couple weeks out, and I am pretty full, but I love making time for sharing and showing others what tools are here for their optimal health. And I love making time to share with doctors just to know what is out there, so they can see if it's a good fit for their people coming into them, whether, it's just an occupational therapist or your own OBGYN or, yeah, I say dentist because I know people get in that chair and it's like, you feel like you're in therapy and you're like, oh, and I have this shoulder thing. Oh, and they start going into it. Or I had this TMJ, like I could barely open my mouth. And I know there's ways to collaborate and bring together what we consider our health practitioners.
Yeah.
And it is a medical device, so I do, and why I'm asking to get through medical facilities is because that's what I'm looking for healthcare in general. And whether you've had surgery, someone that's had surgery, where we could have one of these instruments at every hand while you're starting that therapy would be exuberating for anybody's health.
Well,
and
I think your point is well taken in the sense that if there's any medical professionals out there that are listening to this show and you're curious about this device and how it can aid the quality of life for your patients, I think this would be a good time for them to reach out to you and to be able to at least get the information from you as to how this may work for their office. I mean, I don't know the best way for them to reach out to you, Kelly, is either through your website or is there a direct contact to you?
There's a direct contact, 808-485-9697. Can't get more direct than having a conversation with me. I do have a website, microcurrentelectrotoxicologist.com, which I know is on your radio channels, and you broadcast that very well. I appreciate that. Kelly's Time on Instagram, and I have a Facebook page as well. So
you muffled on your phone number. Your phone number is 485-9697, right?
Correct.
Okay. So yeah, I mean,
I have an offer for any of your listeners.
Okay.
Can I share with you something? I would want to offer a free protocol. That's free. It's a tongue twister. 3 free sessions. One protocol is 3 consecutive sessions. And all you need to do, call me, let me know you heard this offer on your show, Be Fit for Health, and leave me the details to coordinate with your choice of practitioner, and we can show them and go forward with your 3 free sessions to show the medical staff what is available, how it feels for you, and we can go forward on getting you your consecutive sessions. So even if it's just one day at your medical facility, we can move forward and get you feeling better and having your optimal health in your control.
So the free session is 1 session out of the 3?
1 session, let's get to your doctor's office. I know they're busy, and I know they're seeing a lot of patients, and this is a good 45-minute to an hour and 15-minute session, each session. So we do take our time with you. I take my time. I make sure what your body is saying. And yeah, it's 3 free sessions. If we can get one in your practitioner's office, that's your MD or pediatrician, your chiropractor, your licensed acupuncture therapist, wherever you go for if it's a nature path and you want to align your health with what you're already doing, let's go from there. If it's your primary doctor's office, if you're already in PT and are thinking, look, this might align with that, we can go and coordinate. They need to mention your Be Fit for Health radio program and let me know you heard it there. Okay,
perfect. All right, girl. I wanted to make sure that everything was understood, and I will post this on my YouTube when I create the video for this broadcast, and I will post it also on my yeah. And so, listen, guys, if you can't reach her, reach out to me, and I will get you in direct contact with Kelly. Like I said, there are so many options when it comes to our health and well-being. Don't limit yourself. I mean, I'm bringing on folks like Kelly because I want you to know that she exists, and there are things that you can do to help your body get back to balance. And believe me when I tell you this, don't believe what I'm telling you in the sense that it works for me. Go and experience it for yourself have your doctors test this out. If you're concerned about, whether or not this is right for me, have your doctor's office, have Kelly bring it in and work on the doctor or one of the practitioners there or the nurses. Yeah. And have them experience it.
Yes, they need it the most.
Yeah, seriously, because these guys work so hard, you know what I mean? But at the end of the day, there is an option for you to feel better, because living in pain we shouldn't be living in pain. That's not what our body is about. So if we can minimize it even to bring a quality of life, I mean, God bless you, Kelly, for doing that for me. But I know you can do that for so many people on so many levels.
Right back at you. I appreciate you having this forum and getting across so many different modes to communicate health and wellness to not just our community, but you're going wavelengths too, sister. Yes. And I really appreciate you. And I just want to say one more thing to your listeners. If you think you tried everything, if you've never heard of the Elctro Equiscope, you haven't tried everything. So it's here waiting for you.
Yes, I was going to say, yes, go give it a try, because you have nothing to lose, right? At this point, you've tried everything. You have nothing to lose. Kelly, love you. Thank you. Appreciate you. And I definitely will have you back on for more stories. And, between the both of us, we have enough information to get people to a place of less pain and hopefully a better quality of life. So I wish you a good day, and thank you for joining me today on my show, Kelly.
Thank you so much.
All right.
Aloha.
Bless you. All right, you guys, I just want to say again, my website is befitforhealth.com, the number 4, befitforhealth.com. You can go ahead and go to the contact page and reach out to me there if you need more information. Kelly's has an icon on my page as well, so if you want to go directly to her, there is a spot there for you to reach out to her from there. Also, if you need to contact me via Facebook or Instagram, I'm on there with the same name. Lastly, YouTube. I have a YouTube. I make a video. This show is on there as well. So if you want to be able to listen to it again and reach out to me through my YouTube, go ahead and subscribe, become part of my family there, and we'll take care of you there as well. Thanks again for another great show and joining me. I wish you guys a happy Sunday. Be safe, be healthy, and aloha.